You are listening to the Health and Wellness Connection podcast, the #1 wellness podcast designed to provide the latest information to help you achieve your health and wellness goals. Our show features exciting guests, the latest in medical research, and in-depth discussions in current trends on weight loss, nutrition, and fitness. No matter what your interest, the Health and Wellness podcast has you covered. And now, presenting your illustrious host, Dr. Barry, MD.
Hello, and welcome to the latest episode of the Health and Wellness Connection. This is your host, Dr. Barry, and I want to thank you for joining us for what I hope to be a very entertaining and very informative episode of our podcast. Again, so by the way, I just want to reintroduce myself. I have a lot of new listeners. I want to make sure everyone knows who I am and what I've been doing. So this is the Health and Wellness Connection podcast. We've been doing this for about 5 years now, bringing you the up-to-date health and wellness news topics. I'm your host, Dr. Barry. I am a board-certified emergency medicine physician, as well as a health and wellness physician. So I do help people with weight loss and wellness. And this show is designed to kind of bring you some of the latest, research and topics out there that are, being discussed in the wellness community. And we try to make sure we bring information that is accurate and research backed. So we don't just kind of discuss random theories here. We like to bring articles to verify and to kind of go over those as well and talk about, what makes some of these new, developments, interesting and how can they potentially improve our wellness. So ultimately, we're here to bring good information and hopefully you'll get some benefit and maybe it'll help you on your wellness journey as well. Now, before we get into that, we do have some sponsors. First things first, we have to talk about the body butters, guys. We have some of the hottest body butters now out here. Dr. B's body butter, and it's actually made out of natural ingredients out of Africa. Actually, we import ingredients from West Africa, and we make a body butter, one out of shea butter. It's very nice, as well as a cocoa butter preparation. And soon we're going to be putting out an avocado-based butter as well. These butters are, again, doctor formulated, all natural ingredients, extremely effective, and highly recommended that you should try it out today. You can order it right now on our website, www.naturally.africa. Again, that's www.naturally.africa. You can order those now, and they'll be shipped to you anywhere within the United States, as well as South America and Canada. So soon we'll have worldwide shipping, guys. So international listeners, to stay tuned. But yes, check out the body butters, www.naturally.africa. Also, we're going to have a lot more guests, guys. We have an exciting interview coming up as well next week. And we're going to have a lot more guests that are on the horizon that we're booking currently. So stay tuned for that. And lastly, guys, if you want to find out or contact me or the show, reach out to us at our email, drbarryhealth@gmail.com. Again, that's drbarryhealth@gmail.com. You can find me on TikTok at Dr. Barry Wellness 1. We're also on Instagram at Dr. Barry MD. And also we're on Twitter, even though we're not on there as much, but Dr. Barry Tech Doc. So again, guys, we have some pretty good articles, guys, about some of the latest news and developments and research breakthroughs in the wellness space. And of course, just for the reference, we do go to Medscape to get a lot of our research, as well as CNN Health. We also do healthline.com. Also, we check out Science Daily. So if you're interested in getting some more info on these topics we discuss, go check out those sites and definitely take a look. A lot of good information on those sites. A lot of it's good and easy to read as well. So, okay, so the first story that I want to discuss was about, all right, so this latest article talks about how a U.S. judge has blocked Robert F. Kennedy's efforts to change U.S. vaccine policy. So one thing that we all know, especially if you follow U.S. politics, is that the new health secretary, Robert Kennedy, has been really anti-vaccines. And that's something that's been evident based on his policy decisions and things he's been doing while he has been in the position. Now, one thing that he tried to do recently was that he wanted to try to basically overhaul the vaccine recommendations that are typically given, by the government to ensure that kids are vaccinated throughout their birth period. There's usually ages that kids are supposed to receive certain vaccines. They do this throughout their childhood until they turn 15. Now, this is something that has existed for many years, and of course, there's been a lot of controversy with vaccines and whether or not potentially some of the ingredients are harmful. But I think, the way he's not a doctor, the way Robert Kennedy is going about this whole thing is that he's actually trying to just get rid of any opposition parties who may be, on the health department's committees, and just basically put his own people in place. So this actually, we reported on this a few months ago when all 17 people of the CDC Vaccine Advisory Board were removed, and he put it on his own people. And so I'm sure this was part of the whole process. Once he replaced the Vaccine Advisory Board with his own constituents, they then created this new recommendations, which essentially just reduces all vaccine administration. And the problem is that people are still confused as far as vaccines and what they're used for. Vaccines are one of the best preventative medicine kind of treatments we have, where we give people a treatment that is designed to make their body more resistant to a certain infection. Vaccines have been around for hundreds of years, and the vaccination process is also a very old and medically sound process. And despite some of the controversies, I think overall the studies are clear that vaccines are very safe. Now, that being said, all is not well. You still have to do a lot of research, especially on the newer ones. But I think in general, though, some of the older vaccines that have been around for 30, 40, 50 years, things that have eliminated all illnesses, like the polio vaccine is a good example. The meningitis vaccine has also helped reduce meningitis, and things like that, where diseases that used to be extremely deadly are essentially, they're basically non-existent anymore. Smallpox, another good example. So I think vaccines have shown they can be very effective when used properly. And this heavy-handed approach, especially when there's no actual scientific kind of analysis going on, it's just more like, we don't like this, so we're going to just get rid of it, despite, teams of evidence that the, certain vaccine can be effective. I think it's silly. And especially, it seems like because of this whole kind of process to try to reduce the vaccines that were being recommended, just in a heavy-handed kind of sort of discussion, prior, there was actually a lawsuit filed by pretty much every physician's organization in the country, from the American College of Physicians, Infectious Disease Society of America, the American Pediatric Society, various public health societies. So it's just a massive lawsuit, just suing the federal government, saying that they don't have the right to change these regulations without input from these various organizations, as well as other health leaders who were, instrumental in actually helping create a lot of these recommendations. So either way, it's been kind of a big back and forth, and these are obviously now in the courts. We're trying to delay things to figure out, what the best route forward is. And ultimately, it's something that I think is going to definitely be a big deal. And as a result, there's going to be a lot of discussion on vaccines and whether or not, the current regimen is appropriate. And I think ultimately that there does need to be a full, evaluation by especially the specialists and the healthcare providers who are the ones, more intimately familiar with these vaccines and their use. And, I think looking at that is not a bad idea, but just wholesale eliminating critical vaccines that have been extremely effective, I think is definitely reckless. So hopefully that'll change, but we're going to kind of be following that, obviously, to see what continues with that. But yeah, Robert F. Kennedy is just, doing the most. All right, so another news article we found talks about GLP-1s and talks about how they are being tied to lower risk of psychiatric decline in those that have pre-existing mental illness. So they're seeing patients who have no mental illness, like depression or anxiety, things like that. They're giving them these GLP-1s. They see that those who took them were having reduced worsening of their mental health. So it's kind of interesting. Like, it lowered their depression, lowered the anxiety, lowered substance abuse or disorders. And we talked about that earlier as well. So I think this, is part of that whole dopamine process being disrupted with these GLP-1s. People tend to get less joy. They describe it as anhedonia. And this joy is actually what fuels a lot of addiction as well. If you're super infatuated with eating, you love overeating because you feel good, GLP-1s kind of eliminate that dopamine, response you get from eating your favorite dish. So that's a good way to kind of reduce addictive behavior. So it's not surprising that those who have, mental illness or suffer from substance abuse, a lot of times, these kind of irregular dopamine pathways are part of the process. So it's interesting that they're seeing now that those who are taking GLP-1s are getting, improved or I should say lower risk of worsening depression or worsening anxiety. And I think that's part of, shows there's more of a neurological link with these GLP-1s and how they're effective in their ability to help people lose weight and other processes. So either way, So this study, they looked at the Swedish National Health Register. This study comes out of the University of Finland. They looked at people who had health records from 2009 to 2022, looked at about 95,500 people, and the average age was 50 years old. People had been diagnosed with depression, anxiety, or both, and they had been prescribed these GLP-1s during the study period. So what they did was look at this group of people, and they found, those who were on GLP-1s. Then they looked at their mental health and saw if there was any correlation there. And so they found about 22,000 people of that original 95,000 that were on GLP-1s or some sort of kind of, GLP type medication. And they found that, evidence of decreasing mental illness, meaning like they were hospitalized for psych issues, or they had some sort of sick leave for psych issues from their job, or they hospitalized themselves, or they committed suicide. They looked at the incidence of bad psychiatric outcomes. And what they found was that those people who were on GLP-1s had a 42% decreased risk of worsening mental health. So that's pretty huge. So in a population where there's depression and suicide and a lot of, self-harm, they found that those people who were on GLP-1s had a decreased amount of negative effects to their mental health. This is a pretty big deal. And I think this will probably lead to more GLP-1s being prescribed for patients who have mental health issues, because, if there's some sort of effect that the brain is having due to these GLP-1s that's decreasing depression, I think this is a big deal and needs to be further explored. And again, this was like what we call they looked at just studies of people who had been taking these meds and just monitor them. So I think there does need to be another study that directly looks at GLP-1s and its effects on the human mind, and whether or not there's actually some links on a biochemical level, which I'm sure they are, but they have to be identified, as far as the links of GLP-1s and anxiety, depression. All right, so the next study talks about fish oil, omega-3 fish oil supplements, and there could be a strong link to cutting heart attacks. One recent study out of Monash University, based out of Australia, looked at patients who were actually dialysis patients. So these are actually sicker patients. And these patients have been given omega-3 supplements. And they were looking at the incidence of stroke, heart attack, and different other, vascular issues specifically, and seeing whether or not there was an effect. So what they did was they looked at about 1,200 people. And these people were on dialysis. So dialysis patients are notoriously known for having high risk of stroke, heart attack, very, very difficult population as far as, long-term life expectancy due to just the chronic issues they deal with, especially when it comes with heart attacks and strokes. And so they monitored these patients after giving them doses of omega-3 supplements. These people specifically got about 4 grams of fish oil each day. And they were monitoring them, over this period to see whether or not there was a change in the incidence of heart attacks and strokes. And what they found was that those who were taking the fish oil had a 43% lower rate of serious cardiovascular events. This includes heart attack, stroke, cardiac death, and amputations. So again, high risk population like dialysis patients. I think this is an extremely powerful study, because even though it wasn't as big, and we know there's a link with GLP-1, with omega-3s and anti-inflammation, it just shows that how omega-3s can be extremely beneficial in helping the body kind of cope with some of the changes we see that can lead to heart attacks and strokes. And again, dialysis patients tend to have very, very high blood pressure. They may have, blood sugar levels that are, out of control, things like that. And I think this just shows the power of fish oil. So if you're not taking fish oil or eating, fish in your diet, this shows that, that may not be a good idea. Fish has been shown to have a lot of health benefits, especially with the omega-3 component. If you're someone who hates fish and don't like the taste of fish, then maybe consider taking a supplement, because I think not having a heart attack is probably a good thing. All right, so the next study talks about coffee, and again, another glowing study in regards to coffee. I'm a big coffee fan, and I talk about coffee all the time and a lot of its health benefits. You can check the archives for a lot of stories on coffee, a lot of shows on coffee. But a new study comes out that talks about coffee and how it can potentially protect your brain. Apparently, coffee, if you take it daily, can help protect your brain in the long term. It's believed that people who drink coffee, especially caffeinated coffee or tea, were linked to an 18% lower risk of dementia and better cognitive performance over time. These benefits appear strongest at 2 to 3 cups of coffee or 1 to 2 cups of tea daily. And this is even true in those people who are predisposed to dementia, meaning maybe a strong family history or some sort of other link. Now, this study comes out of Mass General Brigham Harvard University. It was done by the School of Public Health there. They looked at data from about 131,821 people. This is out of a data bank that was assessed. They looked at, patients who were in this data bank that were, found to be moderate coffee consumers. And then they looked at their risk of developing dementia over time or slower cognitive decline. And after looking at the data, it seems like those who were regular coffee consumers had far lower amounts of dementia or cognitive decline than their non-drinking coffee counterparts. And so it's pretty amazing because we all know coffee can help stimulate kind of mental clarity and can make you kind of more awake and alert. But there's never really been any direct links as far as coffee affecting brain health and improving brain age. And so I think this kind of study is very, very important, especially when it's something as large as 131,000 people. So it's a pretty powerful data set. There's a correlation that we see of decreased mental decline. We know mental decline a lot of times is due to things like uncontrolled blood pressure, strokes. All those things can usually contribute to mental decline. And even though coffee has historically been associated with high blood pressure, we've seen now more recent studies showing that that link is actually not necessarily accurate. But dementia is one of those things that can be, very devastating once you're diagnosed. And we know that prevention is key. And so it seems like coffee has certain compounds, especially the polyphenols and the caffeine, which apparently help with brain health. They help reduce inflammation, limit cellular damage, and overall have a protective effect against developing cognitive decline. So I think, again, this is like a retroactive study. They just kind of looked at people's data and correlated it. I think ultimately they need to do now a study where they actually get people and they have a very, focused plan to directly measure coffee consumption and brain health, and I think, this right here, though, I think is enough evidence to probably encourage people to consider coffee consumption, especially if you're someone who has a strong family history of, cognitive decline in the family, dementia in the family, things like that. So highly recommend, again, I'm a big coffee fan, so I'll keep drinking what I've been doing. But if you're someone who maybe is not a fan of coffee, I'm not saying get coffee and put a whole bunch of milk and sugar in it and make it into a toxic beverage, keep it, because it should be more coffee than milk. And you want to kind of minimize sugar usage as well. So yes, coffee may be protecting your brain. All right, so as we get older, one of the things that is always important is maintaining independence. People, as they get older, they want to continue to do things they want to do, drive themselves where they want to go, go to their favorite show or their favorite, club event or whatnot. But, as we get older, that may not be as safe, especially if you're someone who's maybe has weak hips or knees or arthritis where you can't move and walk accurately, or your eyesight is now faded so you can't see. So it may not be safe to drive or go out on your own because you could fall or hurt yourself and have issues getting around. But it seems like there are certain activities that they found that if older people could participate in them, they may have longer periods of being independent. And that is actually cycling. Apparently, it seems like those older adults who cycle tend to be more active and tend to have more years of independence compared to their counterparts. Now, this study came out in Japan. So Japan, which beautiful country, by the way, if you haven't been, I'm a big fan of the country, but they actually have they're very well known for their older population, and the population who's very active and they're very sharp. They've, relatively lower levels of cognitive decline compared to other nations. Now, that being said, they also are big consumers of fish and seafood. So we talked about omega-3 earlier, and that could be also part of the reason why, you see a lot of more, sharper, more alert, less confused older people there. But one thing they also was noticing was that those who are more physically active regularly, as well as socially engaged, tend to be also better at maintaining their independence. And so what they did was they looked at older adults who had been cycling specifically, and they looked at how they were moving and how they were acting and what their needs were. And they found that those who had regular cycling routines, part of cycling clubs, they had far lower risk of needing long-term care, lower risk of death over the decades that they were monitored. So And they looked at over a 10-year period. They looked at a group of older folks who were in the cycling community, and they noticed that again, those people who were cycling regularly were just way more independent, way more functional. And this is something that obviously, if you're active regularly, that's going to be true in general. But I think cycling, they wanted to focus on to see if there was any unique benefits here, and they noticed there was even more of a strong link with maintaining independence and maintaining overall health and wellness if they were cycling compared to those who were sedentary or those who didn't do any kind of activity or even those who did other activities. So this is very interesting because cycling is something that people do. They associate with kids, especially here in the West. But cycling is something that I think, because it's easy on the joints, it's actually better for older people because they're able to move and stay active without while putting less pressure on their joints, which can be difficult if you're suffering from arthritis and other inflammatory conditions. So yes, tell your grandma to buy a bicycle and start moving around if she wants to, live longer, be more independent. All right, so another toxic chemical has been identified now. This is in regards to common pesticides. All right, so the pesticide chlorpyrifos, they've noticed that this pesticide, when people are exposed to it for long periods of time, there's much higher risk of Parkinson's disease, because apparently it affects the dopamine producing neurons and it can cause buildup of toxic proteins that can affect nerve function. So again, this study comes out of UCLA, and they looked at patients who lived in areas with organic exposure of pesticides like chlorpyrifos, and they found that those who had higher concentrations in their environment were more likely to develop Parkinson's disease and had a much higher risk of developing this disease. Chlorpyrifos has been widely used in agriculture for decades. Now, it was banned in 2001 for residential use, but it's still been used on commercial agricultural preparations continuously. And so it's all over crops. We talked last week about certain berries and things that tend to absorb pesticides more, so them potentially are more dangerous than others. So this is something that is very, very concerning, because we always talk about the reasons behind some of these neurodegenerative disorders, cancers, and things like that, and we realize that a lot of these pesticides are partly to blame as well. So either way, they looked at patients who had Parkinson's disease, and so they can figure out if there was a link or not, and they identified about 830 people, and then they looked at others who did not have the condition, who were the same age. And so this is, again, UCLA actually is doing a dedicated Parkinson's environment and gene study where they're looking at people who have Parkinson's and looking for environmental connections that could explain why the Parkinson's is developing in this population. And they found that those who were, especially in California, again, this is out of UCLA, and California is known for its amazing agricultural business scene. They use a lot of different chemicals to produce the fruits and vegetables that they're well known for. And they found that those who were in those communities of the farmers and they were being exposed to this chlorpyrifos, they tend to have higher development of Parkinson's. And they realized that apparently those who were developing Parkinson's were more than likely had a higher exposure to chlorpyrifos than others. And this is probably because they were working in or around farms that use this chemical. And of course, this is part of the reason why it was banned, but obviously, large industrial kind of players probably don't want it banned due to their profit margins and their improved yields. So it's just kind of a very concerning thing. Now, that being said, chlorpyrifos is still being used on a commercial scale. However, I think there has to be a more definitive link, I guess, for them to potentially be able to ban it, because I guess there's enough people who support its use. And all these studies are kind of just, kind of hinting at it. Like, again, this is only 890 people they looked at. So obviously they need more studies, more data. But ultimately, I think pesticides in general, unfortunately, they are necessary in a society where you have massive amounts of people and you need to be able to commercially produce food on a large scale. However, I think finding safe things to use to help kind of reduce exposure to carcinogens and other neurotoxic chemicals is critical. So hopefully more data comes out and, we look at different potential toxic chemicals in our environment. Pesticides have long been pointed to as one of the big reasons why we have a lot of chronic illness, a lot of inflammation and so forth. So ultimately, this is something that definitely needs more study. But yes, chlorpyrifos and their supposed Parkinsonian link may be real. All right, so to continue talking about Parkinson's, Another thing that may be also contributing to this Parkinson's and Alzheimer's epidemic is microplastics. Now, we know microplastics have been notoriously considered extremely dangerous, and they've been linked with so many different issues, including vascular disease, inflammation, cancer, and so forth. But now it seems Alzheimer's and Parkinson's also may be on the rise due to these microplastics and their, extreme kind of presence in all of the things we do in society, and found in our food and our water and household dust. And the fact that these things, once they go inside the body, they trigger inflammation, they can damage the brain and also negatively affect multiple biological pathways. And so it's believed that adults consume about 250 grams of these particles each year. And these particles don't leave the body. They just stay and deposit in different parts of the body, cause inflammation. And now it's believed that they also can lead to potential increased risk of Parkinson's. So anyways, what was going on is they looked in Sydney, it was where the study came out of. They were analyzing the whole microplastics, and they found that people think that, it's not a big a deal. However, after they analyzed people's association with different substances, be it like food they eat, water that they drink, they believe that people consume about 250 grams of microplastics each year, which is quite a bit. 250 grams is a lot. So if you're consuming that much each year, there's definitely going to be an effect, especially if they're associated with negative effects to the human body. And these plastics include polyethylene, polypropylene, polystyrene, polyethylene, terephthalate. I mean, these are complicated names, guys. But either way, you get the drift. Plastics that are used regularly for packaging and different, applications throughout society are known to cause harm to the body, especially the brain. And they do this because they activate the immune cells. Remember, when there's a foreign particle that goes into your body recognizes immediately and triggers an inflammatory response designed to attack and kill it. Now, the body usually is ready for other biological organisms. So when it does the immune response and it kills or attacks these substances, it usually kills whatever's invading, removing it, and then it goes away. However, these plastics are not alive, right? So the body was attack it. It doesn't go anywhere, and eventually it just tries to wall it off. But this whole process creates a lot of inflammation, which overall does damage to the body and can weaken, different organs, including the brain, the blood vessels, and different various organs throughout the body. So ultimately, microplastics stimulate inflammation, which we know is bad. If you listen to the show, you know that inflammation is really the center of all disease. Unchecked inflammation leads to chronic illness. Acute inflammation leads to acute illness. So ultimately, microplastics are a known culprit in stimulating inflammation, which can over time lead to chronic illness, cancer, and other illnesses. So clearly, I think looking at microplastics and how to reduce our exposure to them is key. I'm a big fan of glassware as packaging options, avoiding kind of excessive plastic use. Definitely don't want to be using plastic, reheating that in the microwave. Use your glass or just, get an air fryer. I'm a big fan of those as well. And so, yes, microplastics can be linked to Parkinson's and Alzheimer's. So please, guys, try to reduce exposure as much as you can. All right, so the next study talks about cannabis, and something that we kind of probably already knew, but now there's some scientific data backing it. Comes out of Washington State University. It says that cannabis users find that THC can create false memories. So meaning that people who use THC regularly, they can create new ones out of thin air, meaning create new memories that didn't happen, and they'll swear it did happen because cannabis may sometimes cause them to embellish memories or even create entirely new memories. It also they have difficulty in retaining actual events and memories accurately. So interesting. So what we found was that Washington State University, they looked at folks who were consuming THC, and they started to see how it actually affects their memories. And they realized is that we all know that people who smoke THC tend to be forgetful, things like that. But now we're seeing that, with this new study, that it actually affects memories in different areas. Like it actually influences how you create memories, as well as influences how you recall memories. And also it can potentially cause you to embellish memories, just not even intentionally, because your body's actually react to the environment or whatever incident's going on, and it may embellish different, components of the actual event, and creating memories that may not actually be real, as far as they're not linked to reality. There's no actual real component. It's more something that was created. And so we all know that, THC makes people more creative. They tend to have more kind of vivid imaginations, if you will. But it seems like this may actually be causing them to believe things or think things are happening that actually are not happening. I think we are all familiar with the idea of the paranoia, people who smoke THC tend to be more paranoid. They think they see things, hear things, people are chasing them, so forth. So either way, so they looked at, kind of interesting study. They looked at 120 cannabis users, and they looked at folks, they gave some people placebo, some people 20 milligrams THC, which is considered a small to moderate, and they gave others 40 milligrams THC, so a little bit higher dose. And they wanted to see if, A, those who smoked THC, was there truly a memory kind of issue there as far as how they formed and developed memories? And they looked at those who smoked little versus a higher level THC and whether or not was there an issue with, how they created memories or formed memories with the higher dosages. So they had them do the THC, then they had them participate in an hour of memory tests. And they did things like, recall tests and memory games, word games, things like that. And what they found was that those who were consuming cannabis performed significantly worse than those who received the placebo. So no shock there. Those who were sober were able to memorize more, were more alert, more aware. But they found that those who were smoking cannabis, they were like dramatically worse. Like they couldn't remember crap apparently, according to those who were sober. And they found also those who were smoking cannabis, they were more likely to create false memories, swear that they saw a word in the word test that had never been used. They would, they couldn't use process to link words. Maybe they got a series of words and they were told to link them to a certain theme. Those who were sober did those without issue. Those who were on cannabis couldn't link the themes correctly, and they had a lot of issues kind of putting things together and coming up with the kind of salient point that was trying to be created. So ultimately, it found that those who were smoking cannabis, were a little dumber, basically, a little more silly, a little more, full of crap, basically. So that being said, we know a lot of people like say cannabis has no ill effects. Obviously it's clear that there are some ill effects when cannabis use. So while it's, can be used successfully for many other illnesses, there are some issues that cannabis can hurt, and that is with memory and recall. So I wouldn't advise smoking a bunch of cannabis before you go take a test, for example, or don't, do any kind of strong neurologic or mental test when you're extremely high, because that could affect, how you function, and you won't be definitely at your best. And that's something that most people already knew, I'm sure, but obviously, as cannabis becomes more legal in different states, so this came out of Washington State University. Now we can actually do real studies on cannabis legally. Hopefully we have more of these. We can really look at cannabis's effect on the brain and, what true benefit we can get out of it. We know there are some benefits, so let's figure out what actually works and go for there. Now, the next study actually talks about cannabis, and this looks at cannabis's efficacy for psychiatric illness. There's one thing that we know, especially in the ER, as an ER doctor, I see a lot of patients who are having psychiatric issues, they're either depressed, increased anxiety. And one thing I've seen it consistently is that almost all of them use cannabis. And some will say, they'll say, I don't take my meds, but I smoke, but yet they're in the hospital for a psychiatric, decline. So obviously there's a belief out there that people think if you smoke cannabis, it's going to help you with your mental health. And this is like people who have depression, schizophrenia, true psychiatric illnesses that require intervention and treatment. And some people are trying to substitute that with cannabis. And we've kind of known in the medical community that this is not actually a good thing. Like, you cannot be smoking cannabis and you're actively psychotic thinking you're going to get better. No, you won't get better. You probably get worse, actually, because as we just stated earlier, cannabis has been linked with, kind of affected mental clarity. So if you're already kind of having some baseline mental issues, and then you now put more confusion on that with cannabis usage, it's probably not going to end well. So what they did was cannabis users who were known to have conditions like anorexia, anxiety, PTSD, opioid abuse, things like that, they were seeing those who smoked cannabis and whether or not there were decreased, hospitalizations, decreased mental decline, episodes, things like that. And they found that there was actually none. There was people who were using cannabis did not have any decreased symptoms of, their mental decline. They were still being hospitalized the same. They were still being kind of declining, and they, were universally found to need absolutely to take their actual antipsychotics to help them with their mental issues. And this study was actually done based on a systematic review of previously performed studies between 1980 and 2025 of folks who were known psychiatric patients as well as cannabis users, and looking at, if there was a decrease in hospitalizations or any improvement in their mental health with known cannabis use. And they found that there was obviously no improvement. So ultimately, cannabis, while definitely there are some good things about it as far as its effect on certain issues, especially when it comes to anxiety. Some people have good results with pain with it. It's definitely not ideal for treating mental disorders. So please see a psychiatrist. You cannot, replace psychiatric treatment and management with cannabis use. It just doesn't work. And the more and more data is coming to reflect that. Okay, so one more study here I want to talk about. This is, well, not one, we got a couple more actually. This one, though, talks about a very controversial topic as hormone therapy. Hormone therapy has something that's been in and out of the medical kind of sphere for many years. It's been believed that, people who are going through menopause, but women who are going through menopause, men who are suffering from low testosterone, they believe that, hormone supplementation is a good way to kind of avoid some of the negative side effects that we see when people get older. Now, we know there are natural ways to improve those things, but, sometimes people like to just take, quick, treatments to help them boost, their hormones that they feel that they should have higher levels of. Now, a big thing, of course, was hormone therapy, where patients were being started on hormones to help them, with some of the things that they suffer from, especially when it comes to menopausal females and, again, men noticing low testosterone, decreased sexual performance, things like that. But what has been discovered recently, this is actually out of Israel, and they looked at over 80,000 men and women. They looked at 80,000 women aged 50 years or older, and between the years of 2000 and 2022. And they showed that those who were on hormone therapy, especially after the age of 65, had significantly increased risks of hormone-sensitive and non-hormone sensitive cancers. They also noticed increased risk of cerebrovascular events, so meaning stroke. So, and it's kind of concerning because 50 is usually when patients are going through menopause and maybe they have decreased energy and they have decreased sexual activity, sexual desire, and sometimes hormones can help with those conditions. However, it was found that those who had been taking it, and especially after age 65, they were noticing markedly increased risk of stroke and cancer in these patients. So it's kind of unfortunate because, people definitely want to be able to feel more active and feel more, more youthful, if you will, with hormones. But some of the risks associated with hormones are definitely not being fully addressed and, prevented. And so that, is very important. And I think this is another reason why, physical activity is very important, because physical activity can help actually delay some of these things we notice with folks who are going through these changes as they get older. We know muscle mass can help with testosterone levels. We know physical activity can help with testosterone levels as well. So being active can treat a lot of these conditions. Now, that being said, people swear that using hormones is the way to, kind of delay those things we feel as we age. But, now with, some of these new reports coming showing increased risk of strokes and cancers, I think that we have to really understand, some of the risks before we start committing ourselves to focusing on supplementation as opposed to lifestyle and behavior modification to help change those issues. So ultimately, over 65, hormone therapy, probably not that best idea, especially if you're not a fan of cancer and stroke. All right. And so that's pretty much it, guys. We are, going through the motions right now, trying to make sure we get everything to you guys as efficiently as we can. And so we just want to thank you guys for continuing listening to the show. Stay tuned. We have a lot more, again, exciting shows, exciting guests, and just a lot of exciting stuff on the horizon. Thank you for listening. This is Dr. Barry, the host of the Health and Wellness Connection. You can reach me on various social media platforms, including Instagram at Dr. Barry MD, TikTok, Dr. Barry Wellness 1, as well as email drbarryhealth@gmail.com. Thanks for listening to today's show. We're going to be back next week with more info guaranteed. Until then, peace. All right, so the next study talks about that came out with this one. They actually looked at 32,000 patients.
Thank you for listening to the Health and Wellness Connection podcast and radio show. For more information on ways to get healthy, please check us out. www.anchor.fm/HW Connection. Here you can re-listen to the show, check out older shows, and even further support the show by becoming a subscriber to the podcast. Please check us out today. Again, that's anchor.fm/HW Connection. And And also, don't forget to follow Dr. Barry on Instagram at drbarrymd. Until next time, stay healthy.